Feeling tired a lot? Last week, I talked to you about fatigue with Dr. Jack Marandino, a Best Life medical advisor. He talked about the physical causes of fatigue. This week, I'm bringing in Adrian Brown. She is our Best Life advisor. She's a psychiatrist, and she's going to talk to us about the psychological reasons that you might be feeling tired. So Adrian, tell us about this. What are the main psychological reasons that somebody might feel fatigued?
So the first thing I want to do is reemphasize what Dr. Marandino may have spoken about, which is getting enough sleep,
right.
Because there's a difference between being tired and being sleepy. Right. So for people who are feeling tired or sleepy, that getting enough sleep, which is usually for most people about 8 hours a night, I think very few Americans get that much sleep. And probably one of the big reasons is because they're on their screens. But other reasons for not getting enough sleep include, not having a regular bedtime and time to wake up, exercising too late in the day, drinking caffeine or alcohol late into the evening, those kinds of things.
Right. And anxiety, it's one of the reasons for people feeling fatigued?
Sure.
They're anxious all the time?
Anxiety is actually characterized by, one of the characteristics of it to make the diagnosis are physical symptoms that include fatigue.
Wow.
And the other aspects are excessive worry and feelings of tension.
And of course, depression is the classic, right?
Absolutely. One of the cardinal symptoms of depression is loss of energy. And the way I would diagnose that is to also ask about mood issues, like are people motivated to do things? Are they getting enjoyment from the things that they usually feel enjoyment from? Are they feeling hopeless? Are they feeling helpless?
So if they're having those symptoms plus fatigue, then you start to think maybe it's psychological,
Absolutely.
Right? And then, curious, if people come in, do they think first that they have some physical ailment, and then finally they see the psychiatrist? Or do the people come in and say, I must be fatigued because I'm depressed?
No, I would say that it's almost always people are looking for the physical reason. In fact, some people come to me after having had extensive and expensive, invasive tests to try to root out the reason, whereas depression and anxiety are very common. They occur in about 25% of Americans in the course of their lifetime. So if the most obvious reasons, like Dr. Marandino talked about last week, have been ruled out, then the next step should be a psychiatric evaluation.
Wow, 25% at some point in their lifetime. That's a lot of people. And I know people end up trying to self-medicate themselves, correct, with drugs or alcohol or even food. Is that?
Very, what we call comorbidity, having both diagnoses is very common.
And so what are the consequences of somebody trying to use drugs or alcohol to fight off their fatigue and depression?
Well, first of all, it doesn't work very well, but more importantly, it runs the risk of making the depression or the anxiety worse, and there are long-term ill effects of that. But also, you can get the addiction can then be an additional problem. So not only are you depressed and anxious, you're also, alcoholic or addicted to drugs.
Right. So you've compounded it. All right. So somebody comes in to see you. You have ruled out the physical, or they've done lab tests or whatever, and it's depression, and that's why they're tired. And so, how much hope can you give the people watching this that they can get treated for this?
Oh, in the modern era, we have excellent, effective treatments for both depression and anxiety. So I would urge people to, talk to their doctor about those concerns.
Good. And so, medication, talk therapy.
Right, or a combination of both.
And how soon could a person feel better?
Well, I think many people feel better just by knowing the diagnosis and starting in on treatment. Antidepressants, and psychotherapy both can take a little while to work, but often people feel better just by identifying the problem and getting started on a solution. Okay,
so within weeks, days?
Yes,
okay.
Sometimes hours. Sometimes people will finish a consultation with me and say, "Oh, I feel better already. I haven't done anything."
That's because you're a good psychiatrist. So I asked Dr. Marandino this question, and I know it's kind of controversial, this concept of chronic fatigue syndrome, syndrome. And so there's probably, I know it's not a real diagnosis exactly yet, or they don't know how to test for it, and it often has a psychological element. Isn't that true?
Well, whether a psychological element causes it or whether it's a result of having chronic fatigue, I think Laura Hillenbrand, who wrote Seabiscuit and other popular books, has been very open about her problems with this. And it can make you really depressed to not have any energy. Yeah, so I think to the extent that you can mitigate those additional symptoms and not make the fatigue worse, it's, again, worth getting treatment.
Right. Okay, so anything else you want to say about fatigue and the psychological origins of it? Anything else?
I think we've just about covered it.
Okay. Thank you so much for all this really important information, and for any of you out there who think that you may have depression, that your fatigue might have a psychological root, get tested, get help, and come to thebestlife.com for some great articles. Just search in the article section under Adrian Brown, and you will find some really informative articles that she's written. Thank you.